The information provided in this podcast is for educational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Welcome to You Represent Science. I'm Dr. Deb Newitz, a patient advocate and someone who spent years inside a system I eventually lost trust in. Those doubts led me here. Anthony Fauci once told his critics, "I represent science." That claim that one person could own science is exactly what this show calls into question. Patients represent science, their experiences, their stories, their outcomes. So I call this show You Represent Science because you do. I'd like to welcome my audience back to You Represent Science. I'm really eager to introduce my audience to my current guest, Nic Hulscher. He's an epidemiologist at the McCullough Foundation, and I'm very excited to have him present. He's everywhere and anywhere. I watch him daily and have learned so much from you and the studies that are being performed at the McCullough Foundation. Hi, Nic.
Thanks for having me.
So what brought you to the McCullough Foundation? How did you end up there?
Yeah, so this all began in 2020 when the COVID-19 debacle began. And I was actually an undergraduate at university, and I was deciding on my next steps. And the moment I noticed something was very wrong with the public health response and the vaccine response, I wanted to get in there and make a difference, particularly through research. So I went to the University of Michigan School of Public Health for epidemiology training, and I was able to get an internship with Dr. Peter McCullough. And that's where it all began. Our first study was actually a systematic review of autopsy findings in deaths after the COVID-19 vaccines. And then since then, I've contributed to the publication of over 30 peer-reviewed scientific studies looking at vaccine harms, COVID vaccine harms, cancer treatments, biolabs.
So let's start off with the autopsy study. That was 325 autopsies that were performed?
Correct. Yeah, it was 325 autopsies. These were all published in the peer-reviewed literature. We did what's called a systematic review. So we collected all of them, put them in one table, every single autopsy case, age, what vaccine did they get? How quickly did they die after the vaccine? What did the autopsy find? What did they die from? And after adjudicating all 325 of these deaths, we found that 73.9% of them were due to or significantly contributed to by the COVID-19 vaccines. And 35% of all of these deaths were from sudden cardiac death and cardiac arrest. And this was followed by blood clots, pulmonary embolisms, immunological system disruptions, which include cytokine storms, so hyperactivation of the immune system, multi-organ failure, and strokes. These were the primary causes of death. And most of these deaths occurred within about a week of the vaccine. And so they occurred relatively quickly. And we demonstrated a causal link between the COVID-19 vaccines and death. And this paper was peer-reviewed and published in Forensic Science International. It became the #1 most accessed research paper in the world at that time, according to the Observatory of International Research. And 2 weeks later, they retracted it. It was baseless, this retraction, and they capitulated to pressure from the biopharmaceutical complex and what I call the vaccine cartel. And then we republished it a second time after another round of peer review in another journal.
And it was horrifying because we saw it. Most people saw this in our daily lives. I received a phone call from my friend early morning, and her 18-year-old nephew had died tragically and suddenly. Didn't even occur to us that it was related to the COVID vaccine. And they did an autopsy several days later. and it confirmed that he had lung clots and leg clots. Still didn't even consider that it was related to a COVID vaccine. And I said to her, does anybody in your family have any blood clots? She said no. Was there any concomitant cancers found? No. And I'm scratching my head, and she said to me, do you think it was related to the COVID vaccine? My son actually at the same time had to receive both doses of the COVID vaccine in order to attend college. And he received the first dose. We were seeing it everywhere. I subsequently, once I moved to Tennessee, I became friends with this woman, and I did a React 19 podcast with her. Her 16-year-old daughter received the second dose of the COVID vaccine that night, went into respiratory distress. They never did an autopsy, but she died several days later. And we were seeing it, and they were refusing to acknowledge it. And the thing that concerned me the most, it was most frequently after the second dose. So the question I always had is, why were we doing a second dose when other non-messenger RNA vaccines, you didn't have to do a second dose? And one thing that I did want to mention was in the VAERS report, 64% were Pfizer, 32% were Moderna, showing the adverse reactions, and 4% were non-messenger RNA. So the rhetorical question I have is, why did they remove the Johnson & Johnson vaccine when clinically there were less deaths, myocarditis, and heart attack? And they did say, out of all these reports, in excess of 35,000 were deaths. 27,000 were people suffered myocarditis, and greater than 20,000 suffered from heart attacks. And then why don't we talk a little bit about myocarditis, which Dr. Peter McCullough was his first clash with the whole vaccine world.
Definitely. So I would say when we see more reports with Pfizer, I think that is because Pfizer appeared to actually be more dangerous than Moderna, despite Moderna having a higher mRNA dose. And I say that because there was a study done by the Florida Surgeon General, Joe Ladapo, and the Florida Department of Health, and they compared Pfizer recipients to Moderna recipients. They found that Pfizer was about 36% more deadly, and increased all-cause mortality 36% compared to Moderna recipients. And so just extrapolating that difference in mortality between the vaccine types, Moderna and Pfizer, you get nearly 500,000 American deaths from Pfizer alone. So why is it more deadly? Well, perhaps it's the SV40 enhancer that they use in the manufacturing process that's actually still in the vials. They don't clean it out well. And so that's possibly an explanation, as well as other contaminants that might be in there. But, you know, it's very worrisome that that was that deadly. And so when we talk about the vaccine adverse event reporting system, as well as it relates to myocarditis, like you mentioned, Dr. McCullough's first clash was with myocarditis. Well, now we've published over 6 peer-reviewed studies looking at myocarditis, and we demonstrated that it is not mild and transient like our public health agencies have claimed. It's long-lasting and fatal or deadly. Its case fatality rate ranges from, depending on the country and study, from 3% up to 15%. And so here's what happens. We elucidated the syndrome known as COVID-19 vaccine-induced cardiac arrest. And this begins with inflammation of the myocardium, myocarditis, that leads to scarring of the heart. Wherever it gets inflamed, that leaves behind a scar. And that scar does not go away, unfortunately. It is permanent. And then we have also found, in an autopsy study, found this, it causes micro scars in the heart, multiple micro scars scattered evenly throughout the myocardium, and this was not seen previously before the COVID vaccines. Pathologists have never seen this, and so it literally looks under the microscope like an analogy. Somebody took a shotgun to the heart and all these little scattered scarring spots, and unfortunately that leads to electrical conduction abnormalities and lethal arrhythmias when subjected to intense exercise during sports or during the morning waking hours of sleep, 3 a.m. to 6 a.m. when there's a surge in catecholamines. And then unfortunately after that there will be a certain critical mass that is reached that leads to the sudden death, the sudden cardiac arrest.
And that's what I also was so disheartened to hear about. I had countless numbers of patients and friends whose children, especially males, had myocarditis and did not realize at the time that it could lead to arrhythmias, death, other like aortic dissection, other issues. And also what's concerning as well is I did reviews of myocarditis, and Pfizer knew at its release that 1% of people were suffering from myocarditis as an adverse event to the COVID vaccine. So what's concerning is people is like, oh, it's a setback, you're sort of can't do sports for 6 months. Which in itself, especially if you were like applying for colleges to, for a sports team, an athletic scholarship, it would be a tremendous impact on your life. But the fact that it could proceed and result in death is frightening and sad.
Yeah, it's very sad. A vaccine should never cause a death. It should never kill anybody. It's supposed to protect people. It's not supposed to,
Right.
put people into the ground. And so it's very worrisome. And it's very worrisome that they lied to us about the fact that that was no big deal. It's a very big deal. I mean,
Yes.
we have literal autopsies of people, 14, 15-year-olds that die in their sleep. They had myocarditis. So this is not something to joke around about. And their lifespans will unfortunately be shortened. When you suffer myocarditis and you get those scars, your cardiovascular health, unfortunately, will not be great. It will not be great.
And then also another personal experience that I wanted to mention is I did have a patient who required a liver transplant due to the COVID vaccine. So he also had the COVID vaccine. It didn't even occur to me, but he had blood clots around his liver. So it proceeded to cirrhosis, and he was concerned that he needed a liver transplant. The irony that I've talked to many people is if in order to receive any transplant, you have to receive a COVID vaccine.
Yeah, it's madness. I want to add to that. We have a paper undergoing review now. We have a case report of an individual who was forced to get a COVID shot, a Moderna shot, for his transplant. And unfortunately, he died within 48 hours of the shot that they forced him to get.
But it's crazy because people are catching on, because I realized that Pfizer releases a new vaccine every 6 months to a year, and they couldn't release its annual COVID vaccine because nobody volunteered to be studied. So that is somewhat of good news. And once again, I also had another, my friend's mother did develop, it started out with myocarditis after the COVID-19 vaccine, and she died awaiting a heart transplant.
Oof.
So it did progress. So I also want to talk about, so we alluded to why is the messenger RNA vaccine technique so concerning and lethal? And you mentioned the presence of SV40, which is the DNA is linked to causing cancer, correct?
Yes, exactly. And we've actually demonstrated this in a very comprehensive case of a woman. She was only 30 years old. She developed a stage 4 bladder cancer after 3 Moderna doses. and we looked in her circulating tumor DNA, and we actually found segments of the plasmid DNA from the vaccine fused into her chromosome 19, again, in this tumor DNA. So it appears that the plasmids, the SV40, the spike expression segments of the plasmids, the ORI segments, these are actually getting into the human genome. And unfortunately, it appears they're causing carcinogenesis and uncontrolled cell growth because, the body does not know what to do when there's now a piece of synthetic non-human vaccine code embedded in its chromosomes.
So another concern that we have with the messenger RNA vaccine technique is it actually takes about 333 steps to manufacture. So some of the concerns I have is the vaccine I might receive is very different than the vaccine you receive. So it might contain some of the DNA of the SV40, and for you, it might not.
Yes, exactly. It's what's called batch-dependent safety. This has been well documented now in over 6 studies. And basically, they found that some batches are what's called hot lots. They kill and injure and maim large numbers of people. And some are dud lots. It appears the mRNA was degraded, or there was no SV40 or what have you, or they were left out of the refrigerator for too long and they did not cause that many injuries. And then there was a middle ground where it was still causing a decent amount of injuries, but not as much as the hot lots. And this does appear to be due to manufacturing defects. Some people have proposed intentionality behind this, but I can't confirm that. But regardless, yes, some batches, particularly the batches that start with E, Pfizer batches starting with E were the most lethal batches, according to howbadismybatch.com. You look at that batch, it's like 98% of the top deadliest batches, the top 100 deadliest batches start with E. And so E basically stands for extreme death risk.
So one thing I want to emphasize to my audience is that this is not conjecture. This is science. These are things that I've observed. My patients have, been subjected to. So, and these studies have been duplicated by across the world. I was reading about Finnish studies last night in the CDC, in the NIH. So this is not, you can blacklist Nic Hulscher, Peter McCullough, myself, all you want. These are studies that are being produced by other sources and multiple sources. And we are locating the DNA, the spike protein in autopsies in pathology. The other mechanism I want to mention is the P53 route. So how can you comment on that?
So we published a study looking at the gene expressions of vaccine-injured individuals compared to healthy control group individuals. And we found that in the mRNA injured, thousands of gene expressions became dysregulated. And this included the P53 tumor surveillance gene. This was literally turned off in the vaccine-injured individuals. And so when that's turned off, the cancers will have a much easier time to propagate in the body. And another study found that the spike protein itself turns off P53 and even BRCA, another gene critical for cancer control. So it appears that any platform, any injection delivering the spike protein into individuals is increasing cancer risk.
So you mentioned BRCA, that's associated with breast, colon, and ovarian cancers. So we have a mechanism present for everybody that even medical students should know, that the P53 regulates our own immune system and fights against the proliferation of cancer cells. And so by knocking this off, we are promoting the growth of cancer cells, which is horrifying. So one study that I wanted to discuss, that it was released by the New England Journal of Medicine, April 2021, stating that 82% of miscarriages were associated with the COVID vaccine. And I actually had this study emailed to me by a friend. And I was having so many patients who were pregnant saying to me, should I get the COVID vaccine? And it was horrifying because apparently it was retracted, taken off everywhere. And I actually looked the other day to see if I could find it. I still do have a copy of it. And they actually retracted and said that the information was incorrect and erroneously stated. On a good point, I was watching Dr. Peter McCullough, and he was talking about going to LabCorp, and you can pay to have COVID antibody tests. So if you are concerned that you still are carrying remnants of the COVID vaccine years later, how can you address this?
Yeah, so spike antibody tests, and LabCorp is like the top company to use. You basically will take a blood sample and you ship it to them, and they'll basically tell you how much antibodies is currently in your body against the spike protein or nucleocapsid of the virus. And so to look for vaccine injury in particular, we want to see, is the nucleocapsid number low? Because that would indicate that, no, this is not from infections, from vaccinations. So you have a low nucleocapsid antibody, but high levels of spike protein antibodies, that will indicate that your burden of the spike protein is likely contributed more towards the vaccine. And so what this can tell you is it's not a direct measurement of circulating spike, but it does give you some critical information of how much spike your body basically did produce, and usually the higher number of those antibodies, the more spike protein that was in your body, that your body was making antibodies against. And so if it's a very high number, over 1,000, over 5,000, some are over 10,000, 20,000, that's when it's indicated to try and help the body detoxify the spike protein.
So do we have treatment to detoxify against the protein?
Yeah, we have some evidence of what likely works and what is safe, but we don't know for sure if it works because there's been no human clinical trials. But so what this is we published a paper on this, looking at all the mechanisms and the lab tests of why it might work. It's nattokinase, bromelain, and curcumin. Nattokinase has literally been shown in the test tube to literally eat away the spike protein and degrade it. So we know it happens. So when nattokinase is exposed to spike protein, it literally dissolves it. And so our best hope is that when we consume nattokinase orally, it does reach systemic circulation and hopefully helps rid the body of the spike protein and helps clear it out, because human enzymes do not know how to degrade the spike protein. It's a protein that was made in a Chinese biosecurity lab and even American biosecurity labs. And so we have that's the biggest piece. The other piece, bromelain, has also been shown to be able to degrade the spike protein. And then we have curcumin, which is not only an anti-inflammatory to help counter the inflammatory effects of the spike, but it also blocks the ability of spike to bind to human ACE2 receptors. And so that's actually why curcumin appears to be a potent natural antiviral. It blocks these pathogens from attaching to our cells through that ACE2 receptor. And so that's what Dr. McCullough recommends. That's what we published. It's in the journal Curious. And there's many other things as well. There's NAC, N-acetylcysteine. This has also been shown to degrade the spike through its disulfide bonds. It increases intracellular glutathione, the body's master antioxidant. And there's a few more things. Even ivermectin has been shown to inhibit the spike protein. And so there is things people can do. And then lastly, there's, and this one's very important, is sweating, heavy sweating, particularly you go in an infrared sauna. We do believe that the spike protein and other vaccine materials do leave the body in sweat. And so that is another way to help clear this stuff out.
And I was also reading about colchicine as another, there was another article that colchicine can actually eradicate the spike protein in your body from the COVID vaccine.
Yes, and colchicine is particularly critical when the patients have myocarditis. It is a very, very potent natural anti-inflammatory, and it comes from some sort of shrub. But it's very potent at basically calming all of that heart inflammation down. And Dr. McCullough does give that to his myocarditis patients and does notice some improvements. And there's been multiple papers published on colchicine for myocarditis, and it does significantly improve symptoms.
Now, can people get a prescription for this? Are there doctors prescribing these as treatment?
No prescriptions needed. All this is over the counter. That's what's very good about this. So you can either buy them all separately. There is a product called Ultimate Spike Detox that the wellness company sells that has all of it combined. And so all of this stuff does not require a prescription, except I believe colchicine does. I believe
yes,
that
colchicine does. And then who do you recommend goes to LabCorp and gets this blood test done? Everybody who got the COVID vaccine?
Well, those who got the COVID vaccine that are concerned about their health, particularly maybe they have some symptoms, some fatigue they didn't have before, some brain fog, some clotting issues, some post-exercise exertion that they didn't used to, or some I would say extreme fatigue after exercise that they did not have previously. Or say you walk up a set of stairs and you can barely, catch your breath after that. Those individuals, may be wise to get that checked. But, anybody who's received these shots, particularly if you suffered a large amount of side effects right after the shot. So if you got the shots, back in 2021 and it put you in bed for weeks, or you felt absolutely terrible, those individuals, it may be wise to get those antibody levels checked.
And certainly if you've had heart disease or cancer or autoimmune disorders, then you probably already are suffering from the consequences. And so one of the things that I wanted to mention, we've talked about our concerns about messenger RNA vaccine technique. We already know that so in addition to the COVID vaccine, there's the RSV vaccine, which is out now. And I know it's only approved for people who are over the age of 60, whereas the other RSV vaccines you can give to other people under the age of 60, and it is not approved for pregnant people. So there are some concerns, why would you get a messenger RNA RSV vaccine as opposed to the other alternative RSV vaccines? So one of the concerns that I'm in a complete panic about is that one of the flu vaccines that's coming out this fall probably is Moderna, and it will be messenger RNA. So what my concern is the flu vaccine is mandated for all healthcare employees. So one of the comments that I wanted to say is in 2025, there were 27,000 flu deaths. And the vaccine at that time was flu vaccine was only 32% effective. And so my concern is, why are we not giving Tamiflu or oseltamivir more frequently? I hear from all my patients that doctors are erroneously telling them that after 48 hours, you can't get Tamiflu. I checked the CDC website. That's actually untrue. So I want to recommend to my public, please demand that you get Tamiflu if you are indeed infected with influenza. The other thing that I want to mention to everybody is the testing for it, and the worst case scenario can be 50% sensitive, or, as I say, 50% insensitive. So a lot of people, even if you suspect they have the flu, go get your Tamiflu prescription. And So the other concern I have in messenger RNA is in the vaccine technique is it's everywhere now. So I went to the vet recently and they offered my pet's vaccines. And thanks to some of the conferences I've been attending, I said, oh, is it a messenger RNA vaccine? And they didn't even know, the vet. So they checked with the office manager, and it turns out that the canine dog flu vaccine has messenger RNA technique. And I looked further, the feline leukemia vaccine is messenger RNA, and the rabies for dogs and cats is messenger RNA. Are you aware of any foods that it might be placed in?
Yeah, and you're absolutely right about the dog and cat RNA injections, and actually they're actually self-amplifying RNA injections, so it's even worse than just the mRNA ones they gave humans. So now they're injecting dogs and cats for, like you mentioned, flu, canine flu, feline leukemia virus, and rabies. And nobody knows, right? Everybody's going to the vet. They're giving their dogs the routine vaccines, and the vets don't tell them. They don't tell you that you're injecting self-amplifying genetic material into your pet that can probably shed, by the way, through its bodily secretions. We don't know how long it replicates for. And so
we are concerned that it is spreading to human beings.
Yeah, I'm very concerned because they didn't test it. They never test this stuff. They never test particularly genetic vaccines. They don't test their transmission risks, their shedding risks. And there has been a Freedom of Information Act request to the USDA for, it's called Novavax NXT, for the self-amplifying pet vaccine. And there's thousands of pages, and there was sudden deaths among pets after these shots, neurological injuries, and large masses growing near the injection sites. And so, this is not a safe product.
And then it's also located in pigs, lettuce, and spinach, except for Florida, which has banned the use of messenger RNA vaccines in those foods.
Yeah, pigs I'm very concerned about. They've actually been injecting pigs with RNA particle injections since 2012, Merck's Sequivity injection. And so it's not even just in the US, it's in Canada, Mexico, the Philippines. And so I don't know which exact pork products will have this. Most definitively the non-organic ones. And so the hot dogs, the pork chops, the sausages, and the ham. If you eat those foods, be sure to cook them at adequate temperatures, and that would hopefully degrade those RNA particles.
Or don't eat them at all.
Right. Or don't eat them at all, exactly.
Which I'm not a big fan of, being that nitrates, actually, foods that contain nitrates are like the biggest cause or cancer-causing food we can eat.
Yep.
And also, I heard that I've seen that they're doing research in placing messenger RNA technique in chemotherapeutic products.
Yeah, they are pushing messenger RNA for every disease you could think of. And they're really pushing hard the cancer angle. They're claiming it's going to cure cancer. It's going to be the most miraculous thing ever. It's going to give your body the instructions, just like the COVID shots, to make proteins. But it won't be the spike protein. It'll basically be proteins found on the tumor. And so this is going to have off-target effects, just like with the COVID shots. It's going to go everywhere, and it'll probably not work whatsoever. In fact, a study found that the COVID mRNA injections in cancer patients could cut their survival time in half. They lived only half as long than the non-boosted patients.
So these are VaxFacts I wanted to mention with Nic Hulscher. So these are facts that I've read about through multiple research origins. So not just the McCullough Foundation. So these are, this is research that we can replicate. But so on a lighter note, I thought we would talk about Hulscher highlights and some more fun topics that we could find more positive with great outcomes. So we mentioned the ivermectin and mebendazole study resulted in 84% reduction in cancer progression. And actually 32% of those people had no evidence of disease.
Yes, this was very remarkable. So we published, it was actually the largest human ivermectin mebendazole cancer study to date. Most studies have been like 3 patients, maybe 5 or 6, and they've been very small, and they were in a select group of patients. This was a real world study of various cancer types. It was lung, prostate, breast, and many other forms of cancers, head and neck cancers, lymphomas. And so basically what occurred was it was 200 of them, active cancer patients, and then they were prescribed ivermectin and mebendazole compounded tablets. They took them for 6 months. And then we obtained their self-reported outcomes of where they were in their cancer after the 6 months. And it was 84.4% of them that said they benefited in their cancer treatment, with the most striking finding that half of them reported either their cancers disappeared, no evidence of disease, or the tumors shrank, regression. And about 32% said their cancers stayed the same, so it wasn't spreading anymore. So this is extremely, extremely positive. And now we need the large-scale, randomized, double-blind, placebo-controlled trials to confirm this major clinical benefit signal we found.
And I just want to mention that in your articles and some other articles, it was productive in treating colon, pancreatic, liver, gynecologic, and leukemias. So I just want to mention anecdotally, that's how I met Nic Hulscher in Washington, D.C., when my friend had called me and told me that her sister had developed metastatic appendix cancer. And she is very intelligent and contacted the McCullough Foundation. And I subsequently met with Nic Hulscher at a Washington, D.C. meeting, and he helped me dose her according to her cancer. She was told that despite chemotherapy and surgery, there was no way she was living a year, and they wanted to directly refer her to hospice. And I'm so happy to say that 8 months later, she's completely cancer-free. And completely. Thanks to you and your assistance with helping guide her in terms of the dosage. But I remember at the same conference we were at, the National Cancer Institute director was asked that same question about what he observed in terms of the studies with ivermectin and mebendazole in terms of treating cancer. And he said that there was no positive research being done. And if you look online in Science, all the records, the papers, they're showing mechanisms on the pathological, physiological level of it helping produce P53, reducing cytokines, eradicating the spike protein. There are mechanisms that we are documenting that it is improving the poor outcomes with the COVID vaccine and messenger RNA techniques.
Definitely. And there's over 12 anti-cancer mechanisms of these compounds across hundreds of studies. Right. And so whenever individuals in positions of authority regarding cancer say these types of things, it's very disheartening.
And that's why every single person, and I receive phone calls all the time. Somebody called me the other day saying that their friend had pancreatic cancer. And I said, look into ivermectin and mebendazole. I get phone calls all the time. And, hopefully at least we can't rely on the traditional journals, New England Journal of Medicine, but maybe we can make our viewers more aware.
Yes, exactly. And our paper is published in Anti-Cancer Research, but it's been under heavy attack. They've been threatening to retract it now for the past month. We've been in a big battle with them to prevent that. And so, it's not easy to get this type of stuff in mainstream journals. And if you do, the large cancer interests try and delete the paper and retract it. And so we're trying to battle against that. Hopefully we can deflect that attack.
And then I also want to mention a more positive look is the alpha-gal syndrome. You did some research with that.
Yes, so with alpha-gal syndrome, this is the tick-induced meat allergy. And so what happens is when you are injected either through a tick bite or a vaccine with alpha-gal molecules, along with ticks, the adjuvants and tick saliva, these are immunostimulating chemicals in there, or with the vaccines, it will be the bovine gelatin, which contains alpha-gal, or the aluminum adjuvants. When you inject those into the human body, your body makes antibodies against the alpha-gal molecule. And so once you have those antibodies and you go eat meat, red meat, which contains alpha-gal, you will suffer an allergic reaction, which could be anaphylaxis or severe hives or other debilitating allergic symptoms. And so it's not good. The incidence has increased 10,000% since 2013. And so it's really just coming up. A CDC study just found that 1 in 4 adults in the hardest hit states have antibodies against alpha-gal. And so, but there is a possible solution. There was a very shocking study that came out recently that found a 96% remission rate of alpha-gal syndrome with ear acupuncture. So it was a very, I would say, strange procedure. You wouldn't suspect that this would help, but you can't argue with a 96% remission rate. They basically had individuals touch a vial containing alpha-gal allergen. They used some sort of electrical detection device around the ear, and wherever the highest signal was, they would insert the needle, put tape on it, leave it there for a few weeks, and then they would return to the clinic, take the needle out, and 96% of them were able to eat meat again.
And as we discussed, I actually have a friend whose son refused to eat meat for a certain period of time. And she actually gave her child ivermectin, and now he's fully eating meat. The use of ivermectin, which, I have not acknowledged until previously, really seems to be very positive and, with great outcomes. I just also wanted to discuss your sunlight study.
Yes, sunlight. Sunlight's is very critical. So first of all, there was a study that came out last year that demonstrated that sunlight, certain wavelengths of sunlight do go through the human body. Like it literally, you see the image, it literally just goes right through it, through the bones, through everything. And while at the same time, they demonstrated that it was significantly improving mitochondrial function and vision. Color contrast and color sensitivity improved by like 24%. And they only got 15 minutes of sunlight exposure, fully clothed sunlight exposure. So it even does go through clothes. And so you really just want to be outside when it's sunny and obtain these benefits. It's very critical. So
Right.
That was very interesting. But when we talk about vaccine injury and vitamin D and sunlight, there have been 2 studies. One of them looked in myocarditis patients. Those who raised their vitamin D from low to high actually had dramatically improved myocarditis symptoms, less hospitalizations, and less overall severity of the heart damage. And then another one found that looked in long vaccine syndrome patients. And those who obtained adequate sunlight about over 80% of them went into remission of their long vaccine syndrome, their post-vaccine chronic fatigue syndrome, when getting the adequate sunlight.
And in the same vein, sunlight, just 15 minutes a day, through the mechanism of increasing your vitamin D, actually does also reduce the incidence of breast and pancreatic cancers. So get outside 15 minutes a day. The kiwi study, I brought two kiwis today to eat. So what have your studies shown about that?
Yes, this paper was very, very shocking, to say the least. So they had a bunch of healthy individuals, and they looked in their skin, they looked in their blood before, they looked at their vitamin C levels, and they were low to average. They told them to eat 2 kiwis a day for 8 weeks, right? So they did that. They came back to the lab, and they looked literally in their skin tissue and in their blood, and they found 3 things. First, they found their vitamin C levels in their skin and blood were significantly elevated. Like, they had much more vitamin C than before, because the kiwis those 2 kiwis will contain 250 milligrams of vitamin C. It's a very large amount from a whole food source. So that's documented. But then the interesting part was they found that skin density increased by 40%. Or actually increased by 48%. And you'll literally see the microscopic ultrasound images. You'll see that the skin looks visibly thicker under the microscope. And it also increased epithelial cell regeneration. Right. So it increased the regeneration rate by like 30%. So the mechanism behind that appears to be increasing the skin vitamin C levels, which in turn increases the renewal rate and the renewal efficiency of skin cells, which then results in the higher skin density. And so this is a very positive study.
So I think, like, all these people that are in the hospitals for skin ulcers and other skin disorders, simply 2 kiwis a day for 8 weeks might be very beneficial. And maybe we could also put the plastic surgeons out of business and avoid facelifts and injectables.
Yeah,
and
I'd much rather eat 2 kiwis a day. At least try it, at least try it before going to get some sort of surgery.
Yeah. So I brought my 2 kiwi. And then your creatine study, which I also think is very interesting. A single dose of 0.2 grams per kilogram dose. So that's approximately a 14-gram dose in most people, showed improvement in memory within 9 hours.
Yes,
that's impressive.
Yes, this was very impressive. So yeah, it was a single dose, a high dose, right? Most people will take 5 grams a day or even less. This was 14 to 20 grams a day, but they looked in sleep-deprived subjects, and this was a clinical trial, right? This was a legit study. They had people stay awake for a long period of time, and then they gave one group the high-dose creatine, and then the other group nothing. The group that received the high-dose creatine had rapid cognitive processing speed improvements. It went up 24% compared to the group who received nothing. And it improved the bioenergetics in the brain. So it was working more efficiently. And so what this demonstrates is, even acutely, creatine appears to be able to improve cognitive function, particularly in a sleep-deprived state. And so for students out there studying long nights, for people working long nights, this may be a decent option, an alternative to caffeine, especially when we see these significant effect sizes. And it's also very safe. Now, do you want to take 20 grams a day, every day? No. But even taking it consistently, which is recommended 5 grams a day for, that's for what they use for the gym benefits. and the muscular strength benefits, but there's even, 1 to 2 grams a day some individuals are taking, reporting these cognitive improvements.
Yeah, I guess a dose, for an episode of memory concerns, et cetera. But I've seen long-term use of daily creatine cause blood pressure elevations and kidney failure. So I would have several men who came in and they were extremely muscular and really the gym was very important to them, but they had the kidney function of, somebody approaching the need for dialysis, like their kidneys were about to die.
Yeah, that's concerning. I've seen a meta-analysis on the kidney function with extended creatine use. They do find some slight elevations in those in some of those kidney marker some of those kidney damage markers and the byproducts of that in the urine. But so yeah, it would be advised to not take this,
Right.
for very long periods of time.
Yeah.
Or if you do, at least get your kidney levels checked.
So I think just like a one dose is fine. But I think daily use, I really would caution against it. Personally, I've just seen so many bad outcomes. And then your psilocybin study.
An 80-year-old advanced Alzheimer's patient who couldn't talk, couldn't remember anything, was wetting the bed every night. She took 5 grams of psilocybin, and then her 4 things were restored. Her bladder control was restored for at least a month after that dose. She could speak in full sentences again. She was only speaking in syllables previously. So she was holding conversations, and she began to remember her past life events, remembered her family's names, and it was very remarkable. So all of these domains were at least temporarily restored for at least a month after that dose of psilocybin.
And there are a lot of studies that it improves depression, as well as aids in smoking cessation and treats tinnitus. So it has multiple uses. Are you prescribed this? Where do you get it from?
You really cannot obtain it unless you're in Ann Arbor, Michigan, who has legalized this or decriminalized it locally, and I believe Colorado. I could be wrong there, but they are now doing the clinical trials on it. The administration has just authorized them. And so I would suspect that there would, eventually they may allow prescription of psilocybin, but currently it's basically extremely difficult to obtain unless you would enroll in a clinical trial.
Nic, thank you for everything. Really appreciate it. Bye. We just heard from Nic Hulscher of the McCullough Foundation. Most of the topic was facts. So these are the facts on vaccines. And I wanted to additionally educate my audience on who's at risk for getting hepatitis A. And those are people who are homeless, incarcerated, illegal drug use, has household contact with hepatitis A, or they're traveling to Africa, Asia, Middle East, Central, and South America. So for anybody getting a hepatitis A vaccine, I only recommend these are people who are at high risk. In terms of people who are at risk for developing hepatitis B and need the hepatitis B vaccine, those are people who have sexual contacts with people who are infected with hepatitis B, people at risk for needle stick injuries, and people who have household contacts with hepatitis B. Another topic that I would like to mention is the polio virus. The last case in the United States was 1979. It is only currently endemic in Afghanistan and Pakistan. So if you are traveling to Afghanistan or Pakistan, I do recommend the polio vaccine. Rubella as well has not been in the United States since 2004. It is currently only endemic in Africa or Southeast Asia. So if you are traveling to Africa or Southeast Asia, I do recommend the rubella vaccine. So why we have attached the measles, mumps, and rubella together, vaccines should be separated and given to people who are at risk for that disease. I do want to discuss MIPS, which is Merit-Based Incentive Payment System, which is the current payment system that physicians have to follow. So in order for a doctor to receive a bonus or a penalty, they have to administer a certain number of immunizations. And obviously, if you're an adult internist or a pediatrician, that is different. But unfortunately, when your doctor is advising you oftentimes on immunizations or medications or blood tests, it's not in accordance to what you should receive or be prescribed, but it oftentimes is in the guidelines of these MIPS, which is this merit-based payment system. So I really recommend that we eliminate the system. It's costly. It has a lot of requirements for administrators. And I think billing has become so complex and insidious and over-administrative and authoritarian that we should resort to billing by time. So the amount of minutes the physician spends with you, either in person, on the phone, or with insurance companies, or talking to specialists, that's how a physician provider should be reimbursed, not by these subjective merit-based payment plans. One of the external influences that I want to mention about the topic of vaccine administrations is schools are required to have completed vaccination records. If they are not completed, then they actually can suffer jail time and license removals, fines, and threaten to have their students excluded from school. In contrast, we had a LymeRix vaccine, so the Lyme's vaccine, which was approved in 1998 by the company GlaxoSmithKline, and it was actually released in 1998, but pulled in 2002. It was pulled because it was considered only 80% effective, and it had an adverse event of arthritis. So I wanted to note that the bar for removing a vaccine has become very low in the last 20 years. Another situation that could be confounding the problem is in 1986, President Reagan signed the National Childhood Vaccine Injury Act, and which said that vaccine manufacturers are no longer liable for their products. So vaccine manufacturers cannot be litigated or undergo any kind of liability suits. So they are completely protected, which is unfortunate. And you can't have a product that you can stand by and not suffer from the consequences if it is not a good product. NIH in 2024 issued a statement saying that vaccines should be studied for a minimum of 10 years before they can completely inform the consumers on the adverse events. So when taking a vaccine, please consider whether it's been issued for at least 10 years. This is as per the NIH guidelines. I'd like to thank my audience so much for listening to my podcast with Nic Hulscher of the McCullough Foundation. I was very excited to have him attend. This is a big information session for all of you. I really appreciate your time in educating yourself and learning and spreading awareness about the facts about vaccines. Please follow me on social media. Give me feedback. I'm really interested in your questions, solving all of your problems and concerns. Please follow me on YouTube at You Represent Science. My podcasts are released every 2 weeks. I really appreciate your questions, concerns, and any subjects that speak to you. Thank you so much for watching. Bye. That's it for today's episode of You Represent Science. If something we discussed resonated with you, if you have a story of your own, or if you have any questions you'd like explored on the show, I want to hear it. These stories and questions matter, and they deserve to be heard. Write to us at yourepresentsciencepodcast@gmail.com. Come find us in social media and keep the conversation going. All the links are in the description. Thanks for listening.